So this is to educate you a bit on the contact tracing piece. All right, so we're not gonna do like a show of hands, but this is just kind of there's some misconceptions in here and just something to think about. They're not all true. So this is the first time that New Jersey has used contact tracing to control an infectious disease. Think to yourself, true or false? That's all. Quarantine and isolation are the same thing and are interchangeable terms. When I give a contact tracer the names of my close contacts, they reveal my identity to that person. A contact tracer will ask for relevant information about my living situation and health, but will never ask personal, financial, or identifying information that would contribute to identity theft or legal action. Asymptomatic carriers of COVID-19 cannot spread the virus and therefore do not need to be tested. So think about that, and here we go. So contact tracing has been around for a very long time, since the 1920s. It's the process used to identify those who come into contact with people who have tested positive, and it's been used for many contagious diseases, and it has been historically somewhat controversial because it is dealing with people's personal information, sometimes their sexual habits. So, you know, the hostility towards the process is not new, and we do have protections in place for the private data that we are collecting. Technology has changed. Obviously, New Jersey does not use these tracking apps that we're all hearing about, but we do have a pretty sophisticated system where we're getting the data quickly from the testing sites and are able to execute tracing in a very quick manner because of that. So why is it so important for this virus? It's highly contagious, it's airborne. We have both asymptomatic and symptomatic carriers, and that really has no bearing on how contagious you are. And there's currently no vaccine and no treatment. So it really, the ball is in contact tracing's court. We need to break the chain of transmission, and this is one of the, oh, what happened? Wait.
You were just briefly muted, but you're okay
Sorry
now.
about that. Okay, thank you. All right, so how does it work? So basically in New Jersey, when you test positive for COVID-19, the lab will always call you, hopefully, or your provider, and tell you the results. Hopefully we're getting to you after that call. But once they get that positive, it all goes into a epidemiological surveillance system. It's the CDRSS. So all those New Jersey positive tests download into our system that we use for tracing called ComCare. So what that does is pull all the New Jersey information and distributes it by county. So for example, I'm working with the Mercer County Health Department, so I'm seeing all Mercer County's cases. Now within Mercer County, we have our own interesting little health department system where we each have individualized health departments as well. I'm a Mercer County contact tracer. I'm working with all the health departments. All right. So who are the contact tracers? There's actually two sets of us. So you have your public health officers and nurses that are working in the local health departments. That would be Princeton Health Department, Ewing Health Department. Then, and I'm sure you've all heard about this, you know, force of contact tracers that have come in from outside. So I am one of those. I am a social work student. I go to Rutgers. I'm getting my master's. And there was a big outreach to get contact tracers on board. There's a goal. There's like 30 per 100,000, I think, for each county. So they've really ramped up our tracing force. And we are all, mostly this first wave, are all graduate students in public health or social work, epidemiologists, social workers. We're all in this field, whether we're working actively or studying to be in it. You'll hear about other states that are having like high school graduates and call centers. That's not New Jersey right now. We have a very well-educated and well-trained force. So how do you know it's a real contact tracer? So if they're calling from a health department, like the actual like nurses within the health department, And generally, for any large scale tracing effort, if it is linked to a church or a place of worship, a workplace, you're likely going to be contacted from the health department. So it will always say Princeton Health Department, Ewing Health Department. Now, if it's one of us, we work remotely. We have all sorts of privacy things. We have our ear things. We're not talking in front of people, but we use a dialer system. So what you will see on the dialer is state of New Jersey. And this is important to note because it's a little different than, I think the governor says it'll always say the health department. Well, actually, if it's one of us, it won't. It does say state of New Jersey, and that can be a little intimidating. And so I do want to put it out there that there are two different caller IDs that you'll see on your phone. But if anyone ever does have any doubts about the legitimacy and you've picked up, you can always hang up and call your local health department, because they know we all are on the same system. So if you say, hey, I just got a call from Julie and I don't know if she was legit, then you can always call your local health department, mention my name or the name of the person that called, and they should be able to look you up and say, oh yes, they're working with us, it's good. So a contact tracer will always identify themselves. We either say, especially the outside ones when we're not actually in the physical health department, we say we're calling on behalf of that health department, or we say I work with the Mercer County Health Department. So there's always going to be that. If we leave a call back, we're going to leave a number. If it's either going to be the number of the local health department, or it's going to be a number where you can reach just these contact tracers. So we're going to leave a number or a callback time, and we'll always confirm your identity in the beginning of the call, just to make sure that you know that we have some information that we couldn't have otherwise. Sometimes it's just confirmation of a street house number, but it's just to kind of let you know that we're legit. But we're not going to ask you for like private information. It's usually just addresses. So we'll never ask for financial information like credit cards, bank account numbers, salary. We will not ask for immigration status, any sort of insurance information, social security number. And everything is confidential. Your personal medical information, it's private. It's only shared with those who need to know, like your healthcare provider, if there's something that comes up. But yeah, we're not asking really invasive questions. So we're making two different kinds of calls depending on the situation. So you've either tested positive for COVID-19 or you've been identified as a close contact of someone who has. So if you've tested positive, a contact tracer is going to call you and say, we have some private health information to discuss with you. Hopefully they've already been contacted by their doctor, so they're aware. They usually let the patient know that we'll be calling. So our first order of business is to give isolation guidelines based on your symptoms, or if you're asymptomatic, your test date, the date you got the positive. We recommend isolation. It varies depending on which, but it's usually if you're symptomatic, it's obviously when your symptoms improve, and there's more detailed guidelines as to what that means, but I won't go into those specifics. They will walk you through that. If you're asymptomatic and you got a test, it's generally 10 days from your positive test that we're asking you to isolate. We will ask about your household, how many people are in your household, what's your living situation, are you in an apartment, a group home, a residential facility, single family home, how many people, that's important, so that we have an idea of what your household is looking like, any recent social gatherings you've been to, and we put it forward that, you know, we ask you to think about if you've been to any events, but then we drill down even more and say, okay, have you been in close contact with someone within 6 feet for more than 10 minutes? And that's the contact tracing that we all hear so much about. But it's important to note that that's done if you've tested positive. We are asking you for your close contacts. Now, a few of our questions trigger some additional support services, like if we ask you to isolate and if you're unable to have a separate bathroom that you can clean after every use, we'll offer guidance in terms of how to clean it. We do have a social support coordinator position that's open right now. And so that person is, and we've had someone in the role, so we do kind of have a plan of attack when we get a trigger for social support services. Grocery shopping, picking up medications, communication to your employer if you're going to be out. And, we work with the local health departments and the county resources to, trigger that support. And so when we ask you to identify those close contacts, 15 or 10, I might have messed up that guidance. And so what we do is we ask you to go back 2 days from when you were symptomatic and give us your close contacts. Or if you're asymptomatic, we want to know 2 days before your positive test. And so that's the world of contacts that we're gathering. Important to note, if you've tested positive, we will not share your identity with your identified contacts, though we do advise that you notify them yourself. But we won't, and they can try to guess, and we're not going to let on that, we're who it is. If you're a contact, meaning you've been identified as someone that was in close contact, we will call you up. We will provide quarantine guidelines and education based on your last contact with that positive case. So if you're a household member, you're going to be in quarantine for quite a long time, because if you are unable to completely isolate away from that case in your household, you have to be in quarantine during the period that they are in their isolation. And then for 14 days after that person gets out of their isolation in your household, we're expecting you to quarantine. So, as you can imagine, this comes with quite a bit of surprise in some cases at this long time period, particularly for households. But if you're just a contact and you were in touch with this person, like say at Sunday services, then you would go 14 days from that point. And we have that information based on the information that the positive case has given us. As far as dates, we will ask you to confirm that just in case there was something wrong there, but we give you a date. And so one of the reasons we're so interested in maintaining the monitoring with these contacts is if you do develop symptoms during that time that are related to COVID, we assume you are positive at that point. So the contact tracing is monitoring the contacts for symptoms during that period. So the way we do that is we set up an SMS, a text message. So we will ask you on the call if you have a cell phone number, and if you agree to use that cell phone number for daily symptom monitoring. It's much easier than a phone call. We can do that as well. Some people don't have cell phones. They don't like to use text. That's fine too. But it's a daily symptom monitoring and say, do you have fever, chills, difficulty breathing? You say yes, and it triggers, you'll get another phone call from a case investigator, hopefully the same contact person, and they will then register your contacts under the assumption that you are now positive. And let's see what else. And so same with the quarantine. People do have issues. They have their jobs, they have their lives. They can't they can't quarantine separately. So we do ask some questions just to gauge how easy or difficult this will be, and that could trigger a response for support if they need it. And a lot of times it's about letters going back to work. Some employers, when they find out you're in quarantine, they're going to want like 2 negative tests for you to come back. And so, we help out with that communication. Okay, so important to note, we do not ask contacts for their close contacts. This is not like an invasive chain where, we're trying to get all these contacts. It's if you are a contact, we're just there to educate you, advise you to quarantine, and monitor your symptoms. All right, so what makes our job successful? I mean, obviously low counts of the virus, but timely outreach. Our goal is 24 hours to outreach to the positive case, and then upon registration of their contacts to get them communicate to them within 24 hours. This is the COVID-19 New Jersey dashboard. The governor goes through this on his calls, and our goal is just to be like little machines here and get that turnaround going and the education. Also, identification of clusters. I mean, we ask, if you're a case, we ask where you've been, if you've been, visited someone, went to a party, where was it? So it's those identifications of clusters, hotspots, that's a really important part of the job as well. Cooperation of the public is imperative. It is challenging. As I said, it's an invasive process, but this kind of meeting and this kind of education is so helpful to help us do our job better. If you can convey just 10% of what we've gone over here to your people, it makes a world of difference. And this is that. So just kind of refresh. If you test positive, you isolate. If you're a contact, you quarantine. Typhoid Marion or isolation on North Brother Island is an example of successful but extreme contact tracing. A contact tracer is trained to inquire about and identify social support needs and will offer guidance and resources based on those needs. But to that point, the most challenging populations that that need this support are the ones that aren't picking up the phone. So it's really important just to, it's awful. I mean, the communities that are being affected are, underserved, and this process can be a trigger to support, but that initial call has to be answered. And, the numbers have to be given. We're finding a lot. They're just, they'll give us the name, but they refuse to give us a cell phone number. And there's not much we can do. So, I beg you to, if you can convey this, there's just the importance of just picking up the phone. Because, it's in the interest of public health. It's not political. It's nothing but public health. So that's it. I am pretty much done. I've just put a few links, and I can't see them because I have my screen's blocked, but so there's in the COVID site, there's a community organization link, and it's got some interesting things for like faith facilities and whatnot. And also there's a new school assistance program for people. And, this is all on the New Jersey website, but it's some good stuff to know if you want to share it. There's a childcare credit when your kids are working remotely and you have to work, that it'll help you out with some money, which I thought was great. So I want to thank you. I hope this was helpful, and I'm all set. Are you good?
That's great. I really appreciate your presentation. I think it was really helpful. And thank you both for being with us. I do understand you have to go.
Stephanie, was there anything else that you wanted to add on top of that?
If you have any questions for us, because I know last time you did, if you just email them to me, we'll get back to you. Unfortunately, like I said, we really do need to get off the call. We have something that we need to handle. Mm-hmm. So I don't mean to cut you guys off, but
no, we're really grateful.
How it is.
We're really grateful for your presence with us this morning. Thank you so much for making the time. For us, the one most common question we always get is, are these slides available or not so much?
I'm sorry that we cannot share these slides because these are Mercer County slides specific. They're not for the state of New Jersey. Great. So we don't want to step on any toes from the state.
Got it. Understood. Thank you.
I do think there are some really good links on the COVID-19 that I can send. I can try to copy paste that right into the chat if you want to take a look. I do believe there's some presentations that you can actually use that are quite similar. So
that would be fantastic.
All right.
Great. Thank you so much.
Thank you both very much.
Thank you both.
Have a good day.